Good morning. I'm L.A. Williams. I want to share with you some observations on a very, very virulent disease that is located not only in South Carolina but worldwide, and that is rabies. This particular viral disease kills millions of people worldwide every year, and the only way I can describe it is that the death from rabies exposure is extremely painful. It is brutal to have to watch, and no one wants to die that way. We are very fortunate that in the United States, and particularly in South Carolina, we have developed a program to address this particular disease, which again, I will point out, is present from the mountains to the seashore in our state. It is a disease that's found in nature. It is particularly often found in raccoons, foxes, bats, skunks, occasionally dogs, occasionally cats, and on other occasions different mammals, but very infrequently in most of the others. In dealing with rabies, there is a very large complex of people that address this disease threat that we have. And our approach to dealing with it is, first of all, educational and informational, but that's only part of the story. We also do statewide surveillance for the occurrence of rabies in wild animals and in domestic animals. And in so doing, we use the information we gather there to make our public aware that this disease can be very close to them, whether you live in a rural setting or whether you live in an urban setting. Pushing promotional behavior and preventive behavior is very, very important. If you don't get bitten or you don't get exposed to the rabies virus, then you are not at risk. But if you encounter wild animals that act in a peculiar fashion and that show up at a time of day when you don't usually see wild animals out and about, the message is simple: don't mess with it. Leave it alone. And the other thing that you can do as a citizen to help minimize the risk of rabies being transmitted to someone, any of your loved ones, whether your wife or your brother or your children or grandchildren, is get your pets vaccinated. We promote this particular practice, again, on an ongoing basis all the time, because the more animals we get vaccinated, we have created a barrier that helps prevent the viral disease being transmitted from nature to domestic animals to our citizens, which is our job, our real job. But now think, there are a lot of people that are involved in rabies prevention. To this point, we've had your environmental health practitioner to whom animal bites are reported as required by law. Now we've had the involvement of the veterinary profession who provides vaccination for our pets. Medical doctors are involved in looking at persons who have been bitten to determine if they need to be given rabies preventive treatments. Now, we don't want to leave out the fact that you're going to be also having some publicity about people that have been exposed to rabies, so that the people in their neighborhoods will know to be a little more cautious as they go forward. Now, all of this sounds very simple, but you have to use many things. You use the newspaper, the radio, the TV. There are also laws and regulations that empower the department to conduct our activities to try to create a safer environment by modifying the behavior of people and doing those things that we can see and do to minimize exposure events and to respond to them in a timely fashion, because that's the secret to making sure that no one dies of rabies in our state. It's a constant challenge to remind people, vaccinate the animals, avoid your pets, avoid those that are behaving strangely, and if you are exposed, go see your medical provider. We don't want anyone dying of a situation that occurred when it is preventable. Our job is prevention and disease control, and we strive and struggle to do that every day. And again, our people in this state are the beneficiaries of the efforts of environmental health practitioners and many others to reduce their chances of being exposed. Again, all these efforts, they may not be glamorous, but they are part of that protective bodyguard that walks with you every day when you go out the front door of your house. And we're proud to do that on your behalf. Thank you.